Welcome to the presentation. Thank you very much for tuning into this. We have a group here today that's going to talk about the Wichita Transit System Health Impact Assessment. My name is Catherine Schultz, and I'll be introducing everyone. We have Tatiana Lin, who is the Health Impact Assessment Project Director, Ivan Williams, who works on HIA data, and then Sheena Smith, who also does data and then focuses on community engagement. And with that, I will turn it over to Tatiana.
Thank you so much for the opportunity to share with you our findings and results from the health impact assessment that we recently completed for the city of Wichita, looking at potential health effects of the transit system in Wichita. So today I will talk a little bit about who we are, who is the Kansas Health Institute, as well as just give you a high-level snapshot of the health impact assessment as a tool. So in the case you're not familiar with the Kansas Health Institute, we are based in Topeka, Kansas, and we are a health policy and research organization with the vision to improve the health of Kansans. As the way we go about it is really working at the state and local level, as well as the communities, by providing evidence-based, actionable, and nonpartisan information. So policymakers and stakeholders can make the best decisions to improve the health of Kansans. So what health impact assessment tool is, the vision and mission of health impact assessment tool aligns really well with the mission and vision of the Kansas Health Institute. As you can see from that slide, health impact assessment is a tool that really helps decision makers, specifically those in the other fields, to see the potential health impacts of their decision. And what's really important to know, that it helps them to see those health considerations, health impacts before the decision is made. The purpose of health impact assessment is really to improve health. And the way that health impact assessment can help to achieve this purpose is really by putting all the information available together from based research, local data, and community voices, and in combination make projections about the potential health impacts. The voice of the community is a critical component of the health impact assessments. Also, health impact assessment helps practitioners in the other field and policymakers to really integrate health as a part of their conversation and dialogue, because practitioners and stakeholders in the other fields like housing and transportation has a lot of competing priorities. And so health sometimes is not on their radar. So what health impact assessment does, it really brings this health perspective into the conversation. It helps to see the health impacts of their work. One thing that health impact assessment helps that some other tools don't do is also provides a menu of options that can be considered by local policymakers, state policymakers, as well as stakeholders in the area in order to improve health. So it's not just points out what can be the potential issue, what is the magnitude of the issue, but also suggests what can really be done to address this issue in the community in order to maximize potential health benefits and as well as mitigate the potential health risks. So hopefully that provides you a little bit of a background. What is health impact assessment as a tool? What is the reasons for using it, and who can use this tool to inform the policy making, to inform decision making. So the project that we're going to talk today about, again, is looking at the potential health effects of changes to the Wichita transit system. So this project was conducted by the Kansas Health Institute in collaboration with partners that you can see on that slide. Specifically, we worked with the University of Kansas School of Medicine, Wichita, as well as the Hugo Wolf School of Urban and Public Affairs at Wichita State University. So those partners were really instrumental to help us engage local communities, as well as to conduct economic analysis, which some of the results from the economic analysis will be available to you later. Also, we engaged the Health Impact Assessment Advisory Panel, and they were instrumental of guiding the direction of health impact assessment, also to really help us make sure that our findings and recommendations are objective, that we look at all sides of the issue, as well as they're feasible and meaningful for the community. However, all this work would not be possible without the funding from the Kansas Health Foundation that funded this particular health impact assessment, as well as the support from the Health Impact Project, which is a collaboration between the Robert Wood Johnson Foundation and the Pew Charitable Trusts. We really wanted to build on the existing work, so we didn't want to start this health impact assessment from scratch. It was really important for us to already look what has been done around the transit issues in the community. So we were able to look into the studies conducted by Olson Associates. They were a contractor to the city of Wichita, which really engaged the community about the transit issues, and based on this feedback produced several scenarios that could potentially be implemented in the city of Wichita. So what this health impact assessment focused on is really taking this work further and looking at what can be the potential health impacts from each of the proposed scenario. So in this slide, which is titled Wichita Transit System, really summarizes the whole project in a nutshell. This was a 12-month project, which had a lot of steps. So the steps ranged from actually making sure that this is a way to integrate health into that conversation about transit, from looking at what really things or issues that we should look at. So some things we looked at is access to healthcare services, education. So what are those issues that can be considered as a part of the project assessment? We also looked at the best available research, looked at the literature review and community input. And using all this information, developed in collaboration with the advisory group as well as the community members, practical recommendations that can be implemented by multiple policymakers and stakeholders that you can see on the right side of the slide. Specifically, the information it produced can be used by the Wichita City Council. It also can be used by Wichita Transit Advisory Board and Wichita Transit. In the recommendations section of our report, we do include more stakeholders and policymakers than can be using those recommendations and implementing them. So the report that you can see, the cover of the report on that slide, would be available October 22nd. We will be available on the Kansas Health Institute website. And this slide really shows you the cover of the report with the beautiful pictures of Wichita. It also shows you quotes from several community stakeholders. So particularly, I really wanted to include those quotes is to show that the community is very passionate about the issue of transit, is really interested about the issues of transit. And also to emphasize that health impact assessment really includes a community voice. It really wants to know how the community feels about particular issues and what is important to them. So with that, we will be next taking you through some of the findings and recommendations, as well as explaining you this Olson Associates concept that's been developed, and Ivan Williams will take you through them.
Thanks, Tatiana. So the Olson and Associates came up with a number of concepts, and we also have on this table a description of the current bus system. The current bus system is a hub and spoke system. So if you can picture a bicycle wheel with a hub being the transit center downtown and the spokes going out to different areas of the community. The first Olson concept A would be a grid system. So it would be laid out more like a grid than like a hub and spoke. And it would have increased frequency, night and weekend services with routes traveling north and south, although it would have slightly less geographic coverage than the current system. Based on estimates we were able to develop, we project that the increase in annual ridership under Concept A would be about 1 million more rides a year. And this concept is the concept that would have the most positive health impacts. As we go through the presentation, we'll provide more information that I think will help in understanding why that concept would have more positive health impacts than the other ones. Concept B, or the optimization scenario, would be an optimization of the current hub and spoke system, but with greater emphasis on higher ridership routes and an elimination actually of lower ridership routes. So routes that currently aren't that have lower ridership rates would be eliminated, while there would be enhanced service for those routes that have more riders currently. And our estimate for that system or concept would be an additional 991,000 rides a year, and somewhat lower positive health impacts than Concept A. Concept C is actually a reduction in services from the current hub and spoke system. It would include elimination of Saturday service, fewer routes, and fewer hours of operation. Because it's a reduced service type of concept, we estimate that there would be a reduction in annual ridership of about 331,000 rides, and the positive health impacts for this would be the smallest that we would see. Concept D is based on looking at expanding the system in a couple of different ways into outlying communities. The first way would be an extension of the current routes to the surrounding communities, such as Andover, Derby, Goddard, and so on. So this would take the existing routes and add to them additional mileage on into those communities. And I'll show you what that looks like on a map here in just a couple of minutes. Under this concept, we estimate there'd be about 425,000 additional riders each year. Concept D2 also involves outlying communities, but it's more of a commuter type system that would involve trips both in the morning and then in the evening for folks going to work in downtown Wichita or surrounding areas around that. It involves park and ride facilities in those neighboring communities, so that the bus would only pick up folks at one or two park and ride facilities, and then it would go directly downtown, often on highways, so that it would be a fairly quick trip for folks going to downtown Wichita for work. And we estimate, based on a couple of scenarios, that the riders for that scenario would be between 39,000 and 185,000. Both concepts D1 and D2 could be added actually to the current system or to either of the other concepts. They're kind of add-on components, or could be. And so here's a picture of the current bus system with the bus routes shown in green. The thicker the green line on this map, the greater the ridership. So the lines that have very thick lines have the greatest ridership. Those with the thinnest line have the lowest ridership currently. Transit Concept A, these routes in red illustrate what the grid system could look like. And the thickness of the lines on this system indicates frequency of service, so that the thicker lines represent more frequent service, the thinner lines represent less frequent service. I might point out under this concept, there's a pink square in northwest Wichita, and that would be a different type of service for that area, kind of demand response service, but limited just to that quadrant, to where the bus could come pick you up there and connect you with the rest of the system. Concept B, optimization, has less geographic coverage, as you can see, than the other ones. The thickness on the lines of this also represent the frequency of service. And along the left-hand side of this slide, you can see the potential health impacts that we estimate for each of the different transit concepts. And then we have Transit Concept C, which would be a reduction in services. And like the prior concept, you can see some reduced geographic area, but you can also tell by the thickness of the lines how frequent the service would be. And as I pointed out before, along the left-hand margin, you can see the potential positive health impacts under this scenario. Now, Concept D1, this is the extension scenario that I mentioned earlier. So these blue lines illustrate basically where these routes into outlying communities would connect with either the current system or one of the other concepts, so that you could get on a bus in Derby and ride it to downtown Wichita by having this extended service into Derby, for example. Concept D2, this represents those commuter routes. So there'd be a couple of places for some of them in the outlying communities, park and ride facilities, where you could park your car, get on the bus, and have kind of direct service to downtown Wichita, where you could go to your employer there or actually connect to the rest of the bus system.
So one of the ways that we were able to say how transit actually affects health is through access to services. This report is broken up into two sections. We have the access to services and then also the transportation mode. This diagram in front of you is called a pathway diagram, and what we try and do here is say, okay, if you have access to education, how is that actually going to end up impacting health? So through education, you're able to increase your socioeconomic status, and then with that change, you have a decrease in emergency room visits and then a decrease in obesity-related mortality. We didn't just focus on education. There's actually 5 areas in access to services. We have healthcare, employment, education, food sources, and then also recreational resources. Today we're going to discuss a smattering of the interesting findings and recommendations from this section, and I'll turn it over to Sheena to start that discussion.
Thank you, Kat. So the community prioritized some areas that they felt was important to access via transit, and one of those areas was healthcare. As you can see on the left, one community member said medical services are moving to the edge of the city, and that is the hardest to catch. Specialized care is particularly difficult to provide access through transit. And we did find that access to reliable transit increases the likelihood of primary care and chronic care visits and decreases the number of emergency room visits. So having access to these services definitely impacts the health of Wichita residents. All 3 concepts would limit access to at least 6 hospitals, 2 of those 6 being full-service hospitals. And concept A is most likely to increase access to health and result in positive health impacts like reduction in vaccine-preventable diseases from being able to get that care that they need through transit. Versus having to go to the emergency room or other things when they wouldn't have that transit available. So increasing access to healthcare depends on timeliness and frequency of transit services and increased access for those populations that do not have alternative means of getting around other than the bus. So thinking about that, concept A and B would increase this timeliness and frequency, thereby accomplishing that goal. So for recommendations related to accessing healthcare, we recommend that locating bus stops near healthcare offices and specialty clinics, especially those that serve children, like the local health department for vaccines, would be very important. And also taking an extra step to encourage healthcare organizations to inform and link their patients to transit services available once a concept is chosen is very important, so that they'll be able to know how to get around and how to use the transit system to their best, to the best of its ability. Another area that was important to the community was accessing employment. This is important not only for those who don't have alternative means of transportation, it's also important for commuters or potential riders that might want to take transit to get to work. And we did find that the most predominant uses of transit is to get to work in other areas in the United States, but this may not be true for Wichita because it is a more car-friendly society. However, to encourage that ridership increase and to make it available for those that don't have a car to get to jobs that might be during off-peak hours, concepts A and B would increase the timeliness and frequency of services. This would improve access to transit for both of these populations. Concept C does not provide this service.
So when we did our economic analysis, our partners at Wichita State helped us with doing that. And they provided data for us looking at how payroll would increase for Wichita Transit itself, with an annual payroll increase for transit staff of $3.6 million under Concept A, $1.9 million under Concept B, and no change under Concept C. So this involves the payroll that would go for additional bus drivers and mechanics and so forth at Wichita Transit. Fortunately, our partners at Wichita State were also able to look at the total earnings impact on the Wichita economy that would occur. And those estimates are $6.1 million under Concept A and $3.1 million under Concept B.
In terms of access to employment, bringing it all together, it's important when people get access to jobs that they attain things that go along with it, like health insurance. This is where you can see the most positive health impacts. If individuals are getting health insurance, they're likely to take it for preventive care and also to their doctor's visits, which would help them avoid having to go to the nursing room and experiencing high costs associated with that. In order to choose the concept that would provide the most access, we recommend increasing the frequency of bus routes and availability of routes at nights or on weekends to align the transit schedule with shift workers' needs, those people that would work after hours and on the weekends, and also exploring the viability of a grid system like that shown in Concept A, because it would provide more direct access to those areas that people need to go. In terms of access to food sources, the community was very interested in this area, but they weren't really sure how to increase or improve access to food sources through transit. One stated, "I would like to see increased accesses to food services, but I'm not sure how to go about doing that." So we looked into this issue based on that feedback, and we found in general people who are more likely to use bus service for grocery shopping did not have access to a car. We can imagine that it would be difficult and a difficult feat to take transit, to carrying all your bags around with you, but it is extremely important for those that don't have a car to be able to have that as an option. So the use of a bus for grocery shopping also depends on available places to store the groceries once they've gone shopping, and also it's dependent on convenience, obviously, the grocery stores being close to the bus stops and how frequent they run. The Metropolitan Area Planning Department, as a result, should consider locating those future grocery stores near transit routes, and this can be achieved through zoning or other changes. And they should also consider some quick fixes, some low-hanging recommendations, including using buses with a low floor area for rolling carts so that there's available storage for individuals' groceries, and also reviewing and changing the 2-bag limit that's currently in place to extend it to a higher bag limit so people can get more of their groceries onto the bus, making it more convenient for everyone. One key element in this health impact assessment was to include visual representations of what routes go to which services. And so I'll give a quick example as it relates to access to food sources and illustrate how you can use the mapping in the report for a variety of access areas to understand these types of findings and to identify gaps and choose the concept that would work best for Wichita. For Concept A, we mapped WIC stores, convenience stores, discount stores like the Dollar General, major grocery stores, specialty stores, food pantries, and farmers markets. And you can see that they're imposed on the map and they pretty much align with where the Concept A goes. However, there are some gaps. If you'll see the red circle, inside that red circle you'll see a large concentration of blue dots, and the concentration of blue dots on the map indicates the number of individuals living within 100% of the poverty level. And you can see on the northern part of that circle, the Concept A does have routes going to that area, but if you'll go to the next slide, Concept B does not go to that area. And assuming that these individuals would have a greater need for public transit and to access services due to their income status, we would like to recommend to explore reasons why there's not a lot of ridership in that area, as Concept B is based on the ridership and made tweaks accordingly. So exploring those ways on why those individuals may not be taking transit would be important, because we want to make sure that the transit service is available for everyone that needs it.
So that's a lot of information that we've gone over, and the report contains even more information than that. One of the things that we tried to do to be able to summarize a lot of information at once is have tables like this throughout the report. This is the Access to Services and Resources overall table, where we talk about each of the subject areas and then include some helpful information, such as who's really going to be impacted by this, and then what's the likelihood of that impact. We also have a quality of evidence scale Some of these subjects, there's just more information out there, such as for healthcare, you're going to be able to find more data as compared to recreational resources. So just keep these tables in mind as you go through the report. This is our second pathway diagram. So the first one was on access to services, which although it can be the full population that is accessing services, really that one can focus a lot on vulnerable populations. Whereas when you're talking about transportation mode, this really is everyone that's changed from a car over to a bus. And what we mean by that is that, so if you're in a car, it's really easy to access your car. You're probably not going to be walking as far. Whereas when you go to a bus, there's going to be some built-in physical activity. So if you look at pedestrian access, that goes over to physical activity, which will then be increased. That will then change your obesity-related mortality. I believe that the literature says that there's a change in physical activity between 8 minutes up to over 30 minutes a day that's just built into your schedule. So we discuss pedestrian access, air particulate matter and emissions, traffic volume, and discretionary time. And yet again, Sheena's going to give us some of those tidbits from the report, and she'll start that now.
Thanks. So when we're thinking about switching from driving a car to riding a bus, we can see improvements in health in terms of air quality. So we found that air quality is a concern for Wichita, and we projected that increases in transit ridership under concepts A and B would improve overall air quality as a result. So more ridership means fewer cars on the road, less traffic congestion, which means better air quality. And better air quality can result in fewer respiratory conditions and other related conditions such as that from that improved air quality. So thinking about that, we recommend that Wichita Transit should consider implementing various strategies like improving the timeliness and frequency of buses, developing universal passes, just doing anything that you can to increase ridership overall to decrease that bad air quality. As Kat mentioned a little bit before, when talking about pedestrian access and physical activity, we found that people who received sponsored transit passes are more likely to use transit to get to work and meet their physical activity recommendations. When public transportation is easier to access, like bus stops being conveniently located, individuals are more likely to walk to access their transit, and public transportation users potentially achieve up to 30 minutes of physical activity daily. So increasing ridership through concept A and B would expect the most positive health impacts and impact the most amount of people that are able to achieve that physical activity by incorporating transit into their day when they used to be driving. So in summary, we recommend that employers, in collaboration with Wichita Transit, should consider subsidizing the cost of bus passes to encourage more ridership and thereby increase physical activity and reduce some of those conditions related to obesity and fewer healthcare visits for those employers that choose to use that service. And also placing bus stops in locations that are connected to sidewalks, crosswalks, and pedestrian and bike paths when possible are important when you do have more people accessing transit and walking to and from the bus, that they have a safe environment, a safe and convenient environment to do so in. So integrating and aligning those transit plans with the zoning and connecting those infrastructures are important in achieving this goal. The last area I'll talk about related to switching from driving to riding a bus is distracted driving. There are certain benefits associated with transit that people might not normally think of. It's easier to think about improving air quality and physical activity, but there are benefits of taking the bus, like you won't be able or tempted or allowed to text and drive if you're riding the bus. So we found that in general, distracted driving causes 1 in 6 fatal vehicle collisions. And concept A would result in fewer distracted drivers, which means fewer amount of related injuries or fatalities due to distracted driving, which would be a positive health impact. So we recommend that the Sedgwick County Health Department and health advocacy organizations should consider increasing their efforts through marketing to inform people about health risks associated with distracted driving, and also to utilize ad spaces to tout the benefits of riding the bus, like no distracted driving and also no exposure to secondhand smoke, which is also an area included in this section in the report.
So in looking at an economic analysis that we were able to do for switching from driving to riding the bus, we found that there's some savings that accrue to the community as a whole. So it's not only limited to those that ride transit, but to other folks in the community. For example, there's a value of the reduced number of accidents as people would switch from driving or riding in cars to riding the bus. And that's based on the savings that would result from lower healthcare costs due to accident-related injuries, as well as the property damage and vehicle damage that occurs with accidents. So under Concept A, there would be about $532,000 in savings estimated. And this is from our Wichita State University partners, came up with these estimates for us. Under Concept B, it would be about $513,000 in savings. And under Concept C, there would actually be an increase of about $172,000 in cost. And that's because ridership on the bus would actually decrease and more folks would need to travel by car with the reduction in services that would occur under that concept. They also provided for savings per vehicle trip numbers. Those are pretty small. Part of that is because there's a large number of vehicle trips in Wichita, as are in any American city, but particularly in Wichita because it is a largely personal vehicle-based community. There's also an annual value of increased discretionary time. So for Concept A, that's estimated to be about $253,000 in savings, and for Concept B, about just over $1 million in savings. So on a per rider basis, per bus transit rider, under Concept A, there's about $103 that we estimate would be saved, and $424 under Concept B.
So yet again, we have one of the tables that will summarize all of this information and add more in. As I said before, it's really helpful for looking at who's going to be impacted. The difference that you're going to see a lot between the access to services and the transportation mode is that this one's going to say a lot more about the broader community instead of just those vulnerable populations. We have all of the different impacts in here, including the likelihood of the impact and then the quality of evidence. To summarize some of the things that we've said today, so I focused a lot on the vulnerable populations, and who I meant by that was minority, elderly, low socioeconomic status, and the reason there is just that they may not be able to drive, might not be able to get to a car, or might not have a reliable one. And being able to have a transit system where they can access services really can impact health. The transit system that's dependable is another thing that's important. As long as the community knows that where the bus stops are going to be and if they're going to be able to utilize it at night or on the weekends, that can increase ridership for the whole community. It also can be important for employment. So if you know that you can get to and from work, you may be more likely to use the bus, which, as we said, nationally, most cities and people in the cities are going to be using the bus for employment. So increasing that frequency could increase the ridership overall. As we said, switching from a car to a bus has built-in positive benefits. We talked about air quality, distracted drivers. There's also the secondhand smoke. That one's really important for children because you can't have smoking on a bus, so children wouldn't be as exposed to the secondhand smoke. So there's just some built-in things that are nice about when you start using a bus as your transit. Finally, whatever transportation system that Wichita decides to use, it could be important to make certain that the public knows what's happening. So where are the new bus routes? What's the location and frequency of the routes? How's the availability? And that way folks know how to utilize it. So having some sort of marketing or just education around the transit system is very important.
So where do we go from here? One of the very important components of health impact assessment is to really continue putting those results in the hands of local and state policymakers as well as stakeholders. So health impact assessment team have been really working in having some community meetings, also informing transit agencies as well as city council officials about the results and findings from the health impact assessment report. And we're going to be continuing doing that. So here on this slide, you can see some of the preliminary thoughts on the health impact assessment report from Wichita stakeholders. Specifically, I want to mention one of the quotes from the director of Wichita Transit, Steve Spade, where he says that the findings and recommendations from the report really help them to test what they have been doing right. At the same time, it provides them with an opportunity to explore opportunities, what they can do to meet the transit needs of Wichita residents. So as we're moving forward, we're going to continue to engage those stakeholders and others in the health impact assessment process. As we mentioned earlier, the report will be released on October 22nd and will be available on the Kansas Health Institute website. The title of the report will be Potential Health Effects of Proposed Public Transit Concept in Wichita. And we really encourage you to access this report. And if you have any questions about the information in the report, we'll be happy to address them. We also will be presenting the findings and recommendations to the City Council for their consideration, specific on October 22nd. But also if they revisit this issue later in the year or in 2014, we will be also doing these meetings in the community, in the Wichita community. As we do more health impact assessment in Kansas, we would like to show you some of the resources we developed up to date. So here you can see two reports. The first report has been done on the potential health effects of the casino development in Southeast Kansas, really informing state level policy. And this report is already available on Kansas Health Institute website. And so on this slide, you can see a hyperlink that you can click on to get access to this report. The other resource we developed is an issue brief that really explains the field of health impact assessment, also the momentum at the national level in the health impact assessment, and looks how this tool can be used in Kansas at the state or local level. And last is the report on the Wichita transit system, as I mentioned, will be available later this month. So with that, we really hope that you find information in this presentation helpful and useful. It was developed for the city of Wichita. However, we believe that a lot of findings and recommendations in this report can be used in your community as you're looking at some transportation-related issues or even the issues of built environment. So again, this is our contact information. We'll be able to assist you with any health impact assessment-related needs. So feel free to contact us. And I would just want to wrap up to again say the words of appreciation for the support from the Health Impact Project, a collaboration between Robert Wood Johnson Foundation and the Pew Charitable Trusts, also the Oregon Public Health Institute. We worked with a great technical assistant provider, Steve White. We appreciate all his support with this project. And the founder for this Health Impact Assessment Project, Kansas Health Foundation. And again, this work wouldn't be possible without the support of the Health Impact Assessment Advisory Panel. Thank you.